Hello viewers, welcome to our channel. Now let's see what are the signs of vitamin B12 deficiency. Even though the vitamin is found in many foods, B12 deficiency and B12 insufficiency and deficiency are relatively common. Low B12 symptoms can vary from physical to psychological. Vitamin B12 is an essential nutrient that your body needs for processes like DNA synthesis, energy production, and central nervous system function. This is often due to limited dietary intake, malabsorption, medical conditions, or the use of B12 dependent medications. Because the ability to absorb B12 from food declines with age, deficiency is more common in older adults. Still, that doesn't mean children and younger adults, includes those who are pregnant and breastfeeding, can't develop B12 deficiency. Now let's see the most commonly reported symptoms related to B12 deficiency. First is fatigue. If you are low or deficient in B12, you are likely to feel fatigued. Your body's cells need B12 to function properly. As such, having inadequate B12 levels can decrease normal red blood cell production, which can improper oxygen delivery. Especially deficiency in B12 for folate can cause metabolic anemia. This condition leads to the formation of large abnormal and immature red blood cells and impaired DNA synthesis. It's important to know that you can develop fatigue and other symptoms related to B12 deficiency even when your B12 levels are considered well range or all only borderline. Next is pale or yellow skin. Another sign that can indicate B12 deficiency is pale or yellow skin, likely the condition called iron deficiency. Anemia related to B12 deficiency may make your skin pale due to lack of fully matured healthy red blood cells in the body. Third is headaches. B12 deficiency and insufficiency can lead to neurological side effects including headaches. In fact, headaches are amongst the most commonly reported symptoms related to B12 deficiency in both adults and kids. Fourth is depressive symptoms. B12 is essential to the proper functioning of your central nervous system, and the deficiency in this nutrition can impact your mental health. Especially, B12 deficiency is associated with a greater risk of developing depression. Fifth is gastrointestinal issues. A B12 deficiency may also cause diarrhea, nausea, constipation, bloating, gas, and other gastrointestinal symptoms. These issues can affect both adults and children. Sixth, difficulty in concentrating and mental impairment. Because a deficiency in B12 negatively impacts the central nervous system, people with low or deficient in B12 levels may feel foggy, headed, and have difficulty concentrating and completing tasks. Older adults are especially at risk for these side effects because the risk of B12 deficiency increases with age. Other signs and symptoms of B12 deficiency may be muscle cramps and muscle weakness, impaired coordination, erectile dysfunction. Other signs and symptoms of B12 deficiency are muscle cramps, impaired conditions, erect dysfunction, vision disturbances. Many of these symptoms caused by low B12 levels are not specific to B12 deficiency, which can cause the condition to go unaddicted. If you are experiencing any of these symptoms, it's important to visit a healthcare profession to undergo appropriate testing and get the right treatment.